Hey, welcome to Medical Stuff. My name is Mark Slim Frankham, and that is Chris T-Bone Finkston over there.
So that actually bears some explanation. So both Mark and I are actually we're substantial human beings in terms of at least height.
Okay, you're a twig.
Yeah, well, that's what I mean, though.
Right.
That was the at least height part in there. So we're both like, what, you're 6'4"?
Yeah,
Okay, they're both pretty much the same height. Mark is more girthy than I am.
robust.
Yeah.
Rotund.
Mark is a stout figure.
I'm fat.
Yeah, I am not. There's not much to it. If I turn sideways, I get really difficult to see.
He actually has no ass. His back just splits into two legs.
Yep.
Only definition he has is when his wallet's in his pocket.
So when we get on scene, it's actually a good way to kick off this episode with a story, by the way.
Right.
So when we get on scene, we'd introduce ourselves as Slim and T-Bone, with him being Slim and me, of course, being T-Bone.
Yeah, but you remember how we came up with that?
No, I don't.
We heard our 911 center tap out a call where they put Lifeline on standby. You turned to me and said, "Slim, it's bad. They're calling out the whirly-bird."
Get the LZ. Yeah. No, I remember that.
That's how I became Slim and you became T-Bone.
Yep. No, I do remember that story. So what are we talking about today? It's just stories.
Yeah, just stories where we talk about training, and then we're just going to talk about things we've seen, and we will call them cautionary tales of what not to do to get paramedics to see you naked.
Yeah, and, and it's hard not to talk about
Is that right?
training. For anyone listening, Mark has a substantially bright light pointed at my eyes to make this easy. Which, given I can close my eyes and perform about the same.
The fact that you opened both eyes and stared straight into it seemed a little odd.
Well, I'm like a cat. But yeah, it's hard to talk about training without having some stories in there. I do want to point out, though, for everyone that's in the medical field listening and is screaming HIPAA at the top of their lungs.
We will keep this generic.
Yeah, we keep these generic. We fluff or change details a little bit to make sure that we're not singling anybody out. Because one of the things that is important to us, I mean, HIPAA has value. And for anyone that doesn't know, HIPAA is basically a very large stack of paperwork that says what we can and cannot say about the encounters that we have.
What does HIPAA stand for?
It stands for the Health Insurance Portability and Privacy Act.
Ooh, yeah.
Boom!
Damn, I thought I was going to get you on that one there, T-Bone.
But anyway.
Yes, all names are changed. In fact, we won't use names at all.
Yeah.
And all generic information, because the standard rule of HIPAA, or the standard rule, I was going to say rule of thumb, but I don't use that term anymore. Do you know where that term came from?
I don't, and I really want to know why you don't use it.
Because back in medieval times, it was okay to beat your wife as long as the stick was not any bigger around than your thumb.
Yeah, I'm not going to use that term anymore. It's actually pretty shitty. That's
Yeah, but so the standard is if you can identify the patient by anything other than the state that they're in, physical state, not like state of confusion, then you're probably violating HIPAA. So we're going to keep it pretty generic on the specifics, but still get the juicy bits in.
Yeah, I mean, because privacy is important. You know, we already face a lot of people don't want to tell us what's going on.
Right.
To save some face. And so if we go violating that privacy, we're going to hurt our own industry. So we're not aiming to do that today.
Right. I mean, you get one beer bottle and anally inserted, and all of a sudden you don't want to answer questions.
Odd. And actually, here's the thing. You might think that's a unique story. It's not.
It's really not.
No, it's not. We go on all sorts of things.
And change the item.
Right.
I've seen a mag light.
Trout.
You've seen a trout?
I haven't seen a trout. That was a famous story when I first started working at our agency. And it varied a little bit, but I finally ran into the medic who ran the call. Mm-hmm. And it wasn't as fantastic as the story had gone, but the basic nugget of truth was that, yes, this man had a trout in his rectum. Here's the problem with inserting a trout.
Well, the scales.
Yes. Goes in one way just fine, as long as it's going in nose
Right,
first.
as long as they're going upstream.
But it was frozen when he got it. Thought out afterwards.
I don't understand these things, and we'll probably bring this up again and again and again. How does this become a good idea?
Well,
there are so many things.
Well, and my dad, which if you've listened to the show, you've heard him on here before. My dad has this thing. He would always say, "How does that pass your filter? Mm-hmm. How does that?" Because we all have a filter in our brain of good idea, bad idea.
Don't.
Yeah. How does that pass the filter?
Hey, I'll take this frozen trout. And yeah, I mean, the thing is there are so many. Basically, if you're going to take anything away from this part of the conversation, is if you desire, and some people do desire, because from what I understand, I don't try this, but it can be very pleasurable. Mark. It can be very pleasurable.
A friend told you, huh?
Well, I read it on the internet.
Yeah.
If you're going to insert anything rectally, make sure it has a flange on the bottom so it cannot disappear northward without a lot of extra effort.
And there are products that are designed to do this.
Right.
Stick with one of those. Stick with one of those. Because someone has thought this out. Someone spent a lot of time.
I don't understand how you get from this feels good to, hey, I got a frozen fish in the freezer.
I'm going to go grab that.
There are just so many things that are a much better idea.
But I will say this, and my next story is the spitting example of this. If you ever have this happen to you...
What does spitting example mean?
Did I say spitting?
Yeah.
That doesn't make any sense.
It doesn't make any sense.
Yeah.
Anyway, moving on with the story.
Okay. I think I was getting the spitting image of is something that's exactly like. And so I took spitting.
Okay.
I think that's where my brain...
Okay.
Yeah, okay.
Yeah, okay. Sorry, I just figured I had to...
No, it doesn't make any... I mean, we can see how my brain got there. It still doesn't make any sense. But, we can see the track it took. We could imagine the track
Although,
it
if
took.
we're going to call that a legitimate thought track, that lends more credence to, hey, frozen fish in my refrigerator.
And that was my point. Thank you, Mark. Thank you for... Okay, so here's the thing. If you do decide to do something less favorable to your rectum, and one, it can actually be dangerous, and two, just call 911, do not call your friends. Here is my case in point. Long time ago, me and a partner, this is back when I was in EMT Basics, this was before I got my paramedic cert, we responded to a Code 1 sick person. That means no lights, no sirens. I got on scene to find a fire engine just outside this particular residence. And I happen to know that this particular fire crew runs with 4 people. So I'm counting the guys. I'm sitting there like, okay, there's 2 guys just by the engine. Haven't gone in yet. That's weird. 1 guy's outside the door. Ergo must be 4th man inside. Well, I walk up to the fellow outside the door, and I know him really well. I say, hey, Captain. Well, I think he was a lieutenant at the time. I say, hey, Lieutenant, what's going on? He goes, well, the man inside has a... And then before he could even finish, 1 guy pops out from the inside and says, I can't cut it off. Piques my curiosity. Cut what off? Well, this guy found a metal ring about, oh gosh, I don't know, 1.5 inches in diameter or so. Now, this was not a ring designed for this, because again, they do have rings designed to go around ye old twig and berries. This was like an auto part this man found.
So hardened steel.
Yes.
Yeah.
And he decided, by golly, I got to get all of my junk through this thing.
Which causes your junk to...
Oh.
It simulates the erection cycle.
Yes.
But the difference is your body can release that, whereas now his body cannot release that, and it's going to continue to swell.
Absolutely.
I have a similar story after this.
Yeah, we've got all the path of blood going in is certainly there. The path of blood going out is blocked. So we have a balloon.
Diminished.
Diminished. Well, I'm going to go with solidly blocked on this man. or at least enough to cause some serious issues. So here's the mistake that he made. Well, okay, the mistake he made was putting his junk in this stuff.
Right.
The second mistake he made was that before he called 911, he called his buddy. I was like, dude.
Oh, that's how you get on YouTube.
What do I do? And this guy is outside of the residence along with this firefighter as well. And he's on the phone calling everyone. And he's just like, no, yeah, you won't believe what Jerry did. Jerry's not the patient's real name, but you don't believe what Jerry did. Oh no, yeah, there's an ambulance here too. No, I'll call Steve. I'll tell him. Hey, Steve. And this is going on for a while. And so my partner goes up to that guy and says, hey, you're being a real terrible friend right now. If that was you on the inside, would you want him doing this? And that guy very cleanly states, looks right back at my partner right in the eyes and says, that would never be me. Partner was speechless. Not much else to say. That's kind of okay. So long story short, this guy ended up having this ring on. By the time we got the truth out of him, which took a while, again, back to that trust thing, about 2 days. And he debated getting it off. And by then, and I'll tell you the look of this thing, it was purple near the ring, or the base, if you will. And it was damn near black towards
Yeah.
the tip.
There's a distinct possibility he's going to lose that.
He actually, from what I understood, he did end up losing a portion of it.
Yeah.
So yeah, that was, and he was in incredible pain.
Oh, yeah.
Incredible pain.
Oh, yeah.
So, and actually it was funny because we called the local hospital first because we weren't really sure, because my partner had the thought is, this guy might need a microsurgeon, which is going to be something we're going to need. We're going to have at the university hospital up on the hill.
Right.
But the closest hospital is not that hospital. So he figured he'd call the closest hospital, see, hey, this is what I got.
Right.
Are you appropriate or not? And that hospital was actually on total ambulance divert. They were so full they were accepting any ambulances. And so he got a hold of a doctor, and the doctor's like, what you got going on? Oh, yeah. No, totally. Bring that. Well, hang on. Let me ask the charge nurse. But yeah, you can totally bring it here. The doc comes back and just says, charge nurse said no. We're full. So we had to go to so we had to go to the university hospital.
So my guy, this was in a previous service I worked in. 60-plus-year-old male on the back end of a 3-day crank bender.
Yes.
Do you remember 3-liter bottles of pop?
3-liter bottles
3-liter
of pop?
bottles. They used to sell.
They're just like, they're as tall as a 2-liter but fat.
But yeah, they're bigger.
Yep.
Right? And the neck was bigger,
Okay.
where, you pour it out of.
Yeah.
Well, it was big enough that he was able to slide this on.
Okay.
And he was using it to masturbate.
Sure.
But at some
Actually
point,
seems like a clean method.
except for the fact that it causes that restriction,
Yeah.
he started to swell, and he finally called us because he couldn't get it off, and he'd been attempting to with a knife.
Oh.
So not only did he have this stuck around himself, he also had lacerations all up and down the tip of his penis because he'd been trying to cut this off.
Oh, my Lord.
Yeah.
I imagine so that he cut like the bulk of the plastic off and just had the top left over.
Yeah, just had like the neck of it and stuff
Yeah.
like that. But I was trying to cut that lengthwise
Yeah.
to get that, to break it so he could get it open. And
I'm going to reiterate what Mark said earlier. These are examples of what not to do.
Right,
Don't
yeah.
do these things.
We are not advocating that you do any of these.
Sticking your junk in random things that are round.
Yeah,
Jesus.
exactly. So I have run the gentleman who probably was not the inspiration, but was the confirmation of not sitting in front of the vending machine and rocking it with your feet.
Oh,
And it
my
came
Lanta.
over on top of him and broke both his femurs.
Oh, Jesus.
My question to him was, why didn't you just roll to the left? He went backwards to get away from it.
Oh, bad
rather than
choice.
just going to the left. If you got to the left, you'd been fine. But he went backwards and it came down on his legs.
I think that happens so fast, instinct takes over, and
Right,
you just
you
run
just
away.
crawl away from it. Well, it'll crawl backwards until you're not far enough away and it falls on you.
Yeah.
Yeah, so yeah, he fractured both his femurs on that one.
Yeah. That actually brings up an interesting scenario of heavy things on top of people. First of all, vending machines are substantially heavy, as it turns out.
Yeah.
But one of the things that we also have to be careful as paramedics is if someone gets stuck under something, or let's say they're digging a ditch, and a ditch collapses. In the same vein of what we're talking about with that restriction around our other stories, penises.
Right.
That can happen with any limb of the body. And so a lot of times
Right.
you get patients that have these heavy items on them. And what that does is it restricts the return blood flow. So what you'll do is as your cells produce waste and particularly lactic acid, instead of being able to cycle back through the rest of the body, it can't. It just all stays in one spot. So that presents a challenge to us as paramedics because suddenly taking this item off of the patient can all of a sudden cause a flood or release of all this waste back into the body. With the buildup of acid in there, one of the things it can do is it can change the pH balance of your blood, make your blood more acidic, and that causes a whole host of problems in and of itself and can be fatal. Sometimes you have to preload them with medications that will counteract that acidity. So yeah, there's more than just a crust injury involved. That's a taxi license I had to get for a Metro West a long time ago.
Oh.
Yeah. And we have a contract where we had to have so many people with a taxi license.
Oh. Okay.
And apparently,
Fighting
someone looked at me and said, "That guy,
Right, yeah.
that guy should get a taxi
That guy
license."
should take a great picture.
Yeah.
So anyway, you can, it's a crush injury. And this is one of the reasons why we don't use mask pants anymore. Masks were military anti-shock trousers.
Yeah.
And what they came from is where did they come from? Ooh.
I'm going to guess the military.
Ooh, you're good.
Yeah, you
You
know
are
what?
good.
That's why I'm a good
Yes,
paramedic, Mark.
exactly.
Yeah, it's the skills of observation.
It came from actually jet fighter pilots. They're compression pants for the lower part of the body, so when they were high G turns,
Yeah.
they would inflate.
And they still use this today.
They do still use it in that instance. We do not use them in a pre-hospital setting anymore.
No.
Because the theory was it would actually auto-infuse all that blood back into your central system.
Yeah, it's just squeezing a toothpaste tube from the bottom, really. That's what you're doing.
But
You're
that's,
trying to put the blood
that's
to the
not
import-
what you're doing. That's what they thought you were doing.
That's what they wanted you to do, yeah.
Right. So what ended up happening was what Chris was talking about was they were just restricting blood flow to the lower extremities. And then when they would go to take them off, all of that buildup of acid and waste product would get dumped back into the centralized system, which was already sick. And there was actually a study they were doing when they found this, and they stopped the study because it was found to be detrimental. And that's when they pretty much went away.
Yeah, my only experience with those was when I was getting my EMT basically trained on them.
Yeah.
And the fire department I worked for, or I was stationed at that time, had them. And
We had them where I worked and when I first started. Because it
Yeah.
was one of those things that was still on the list from the state of mandatory equipment.
it was that thing that everyone kind of knew was going to go away.
And
You know,
everybody, in your EMT class, they said, okay, we have to train you on this.
that's exactly what they said.
And you'll never use one.
Yeah, absolutely. So yeah, and actually kind of going back to drew a blank. You know, beer never helps me.
No, it doesn't.
I always think it will.
It doesn't. No. So,
Boobies. I've just been told that makes people listen.
not ours.
Oh.
So, people or boobies. So, yeah. So, I mean, the thing is that people do. I mean, back to the inserted thing. I've transported a patient who river rocks, and not like pebbles or regular size rocks. We're talking like the kind of stones used to decorate your garden.
Oh, perfect. Okay, gotcha.
Yeah, his wife, him
like
and
a
his
flattened
wife,
baseball.
Yes.
Okay, perfect.
And yeah, him and his wife were out at the river, and they thought this might be fun. And so then I'm now transporting him for surgery because they cannot get him out.
Could you imagine? Although that, I would almost.
Okay, you haven't finished a sentence.
I know, but I almost feel that guy is better off because at least he wasn't alone in the process.
Right.
Somehow that makes
yeah.
it better to be.
Oh yeah.
Because
No,
if you're not
it's-
the only person with that bad idea, then it's like, okay.
Oh yeah.
I mean, you and I have gotten into a lot of trouble that way because we had the same bad idea.
Right. Go out shooting in the woods and anyway, moving on from that story.
No. Long time ago,
Jesus.
Mark and I, because you know, all right, a long time ago, Mark and I decided we had looked on the map and we actually found a little township called Timbuktu, and we're like, we've never been there, so we're gonna go there.
Right. I really realistically thought this was like a small town out in the middle of nowhere. Maybe a little convenience store or a general store and some houses, and just was curious as to see what it looked like.
I figured it was highly implausible, but you know, I could have been wrong. Turns
you
out,
never voiced that before we went out there.
no, not at all. Then you wouldn't go. So we ended up going out looking for this place. I will make a very long story short. Does not exist. It's just a crossroads, and we got very, very stuck there to the point that our coworkers and officials with the county we work in were
come
all
pull us out.
dispatched to come find us. There was no cell phone reception.
Chris and I spent the night in my car.
Yes, we did. Oh, and by the way, the only thing wrong with this car is that the heater doesn't work, and this was February
The
on a
heater
mountain in
worked
Oregon.
Fine. The blower for the heater did not work.
Okay, effectively, no heat in the cab. Who cares what's broken at that point? Anyway, so yeah, to this day, there's still one of the local firefighters at the one of the volunteer stations.
Calls us Lost Boys.
Yeah, all the time. And
I have had officers, county sheriff officers, approach me on scene about it.
Yeah,
One of them to thank me for the overtime that day.
Well, and the best part about that whole thing though is that Mark and I are so distinct.
Right.
Like just like we're characters to look at us. There's no way we're ever like
right.
this.
We don't blend.
No, and to every like anyone, and I guess they now use this like our case as training in their new search and rescue people. Yeah, no, I heard this from one of the officers who is on the search and rescue team because most of the search and rescue people are volunteer.
Right.
And when they bring them in, they talk about this case and they show our photos.
Why?
Why not?
Why are we being? I mean, I don't mind. It's good, but What about our case makes it unique enough to make the hot list? Is it just that we're medics and keep a lookout for these two idiots when you're on scene sort of thing?
Honestly, quite frankly, I don't think they actually do enough real search and rescue stuff, and it's one of the few cases they have.
Okay.
to be dead honest,
Okay.
I think that's what
That
it
has
is.
some value, I guess. So,
Anyways, yeah, this is what I had heard because, of course, a cop recognizes me on scene. He goes, "Hey, did you ever get stuck in the snow with some guy with a mustache and glasses?" I said no, but no, I said
deny.
yeah.
That's the way to
I don't know
do
what you're talking about. Bye. No, yeah, that of course I admit it. And he's like, "Oh yeah," and he starts telling me a story. He goes, "Yeah, I used that actually. We still use that case in our search and rescue training for the search and rescue volunteers." I'm like, "Awesome, cool." And it's like,
Great.
yeah.
Our stupidity, the gift that keeps on giving.
So one of the things we talked about earlier, though, with like, this kind of conjures up different thoughts here, is with the vending machine falling on the guy, and we were talking about, the various things men have gotten their junk stuck in.
Right.
And we start talking about other things that aren't obvious, like the crush injury and the buildup of lactic acid.
Right.
That's kind of one of the cool parts about being a paramedic is that detective work where you got to go beyond what you see in front of you.
Right.
And I do got a good story about that. And this is going to be a little bit of a toot on my own horn. It's not. This
Most
is not.
of your stories are. Go ahead.
Yeah, right. Pretty well. On both sides of that fence. I mean, really. Yeah. But so for example, we had a call the other day, shortness of breath call on its face. So we get there, another agency responds with us. It's a crew that I've known for a long time, I happen to get along with. The patient has a history of COPD, which is a breathing problem. It's a problem in the lungs.
Don't explain it. They can go back and listen to our respiratory call.
Well, I know. That's why I'm just giving a brief thing. But anyway, but yes, we do have a respiratory episode you should listen to.
You're either a fan or a not.
Anyway, so we go on this call. This guy has COPD, and he's saying that he's short of breath. But the first thing he says to me is he goes, "I have a bone to pick with you guys." And so my thought is, well, you're not that short of breath. And he goes, the last time, he's confusing us for another crew, and I forget exactly what his bone to pick was, but ultimately I got out of that conversation by saying, yeah, it totally wasn't me. Finally, he believed us. Anyway, the fire crew that we're working with is like, all right, well, let's get a neb started. And I'm like, well, hold on. I know he's saying he's short of breath,
But
and
he's
he
not
has COPD.
acting short of breath.
He's not acting short of breath. And I have my partner, who's a partner I trust, listen to lung sounds, and he does. And he looks at me and goes, they're clear. And he gives me that look like, I know they shouldn't be clear, but
Right,
they're totally
but they're
clear.
Yeah.
Which gives me the idea that, no, these are legit clear then. So he has clear lung sounds, and his saturations are 94, 95%, but he's on his home oxygen, which he's always on. He's in his 70s, and he's a long-time smoker and a COPDer. So 94 to 95% saturations for this particular gentleman is probably his baseline.
Probably pretty normal.
Yeah, I don't think that this is the big problem. So we start talking about it a little bit more. Like, okay, sir, so are you short of breath? And he's like, yeah, I am. I'm short of breath. I just can't take a deep breath. Okay, so we start doing a little bit more examining. It's like, okay, so try and take a deep breath now. He takes a deep breath and he kind of goes, oh, and he stops. I'm like, did that hurt to take a deep breath? He goes, well, yeah. Is that why you can't take a deep breath? Well, yeah. And he's not one of those guys that's very forward with the information. He wants us to just take him to the hospital and go. Mm-hmm. And finally it comes down to whenever he takes a deep breath.
Is this a PE?
No, it's not.
Okay.
He gets a pain in his abdomen. So we start palpating around, and I start to feel some rigidity on kind of on the upper right quadrant, a little bit into the upper left quadrant of the abdomen. The guy's also an alcoholic.
Uh-huh.
So what I'd kind of determined was, I'm like, you know what? I don't think this is a breathing problem today. I think what he has is probably a little inflammation of his liver. Mm-hmm. And every time he takes a deep breath, it hurts.
Yeah.
So he doesn't take a deep breath. Now, the reason this story is fun is because we end up transporting this guy to a hospital that's way too far away, but hey, that's where he wants to go. And we get up there to that hospital. And now here's the thing. Paramedics and nurses have not always historically gotten along. That being said, I feel I have a great relationship with most nurses, and the majority of the nurses and paramedics out there get along just fine. This was not one of those times. So this nurse pops in and immediately goes right down that track. COPD, can you take a deep breath? Did you guys give him a neb? No, I did not give him a neb. A neb, by the way, is a nebulized medication, for those that don't know. It's one that they breathe in. It's a mist. And so the nurse is like, well, I'm going to go get a neb. Because apparently I hadn't done that, and apparently in this nurse's mind, I should have. I immediately kind of give the eye roll as he turns his back towards me, and then the doctor comes up and it's like, so what's going on? And I look at the doc and I'm like, look, he's a COPD, he's saying a short of breath. Here's the thing. When he takes a deep breath, he gets a pain in his abdomen. If you palp him, it feels like his liver's inflamed. Doc goes up there, palps around, agrees. Nurse comes back with a neb. Doc looks right at the nurse and says, yeah, we don't need that. I just looked at the nurse. Didn't have to say anything. Just looked over and be like, oh, yeah. Cool.
Oh, yeah. We run into that. We ran into that just recently, in fact.
Oh, what'd you guys run into? I mean, you probably were wrong.
This was a transfer from an outlying hospital to a trauma center in our area. And patient had an L1 fracture.
Oh, okay.
Elderly patient.
Right? All right.
So on our notes that we get for the call on the way there, it says needs a backboard. Well, why? I mean, yes, I know she has a fracture, but she's not on a backboard right now.
So
she has not been on a backboard the entire time she's been in the emergency room. So when we get there, I tell my partner, I'm like, let's leave the backboard here. Let's go in and see what we got. We walk in, the doc goes, don't bring a backboard. I'm like, okay, no, I'm down, right?
Yeah.
He goes, just keep her flat, lay her. Now, when we talk about a backboard, the reason we use backboards in back fractures or potential back fractures is because it's basically a big splint for your body.
Right.
The problem with backboards is they're a big splint for your body, and they can cause pressure points.
Especially in your elderly population, which is patient.
So when they lay on them, so it's a plank. A little more scientific than this, but it's basically a long, hard plastic board. Don't even look at me like that.
What?
And when you lay on it, it'd be like laying on a plank of wood. Anywhere that's got a bony prominence or laying flat is going to press against this, and it's uncomfortable. You know,
it's just a penetrating pain.
Stop it. So anyway, he says, nope, just lay her flat. You're good. We're like, okay. So we get a bunch of people around her, pick her up on the sheet, keep her very flat, lay her on the gurney. We head out the door. We get all the way up to the receiving hospital. She's not on a board.
No kidding.
She's not on a board. Well, we need to put her on a board because she has, asked the doctors before I left, and two of the physicians answered at one time, an L1 fracture. We need to get her on a board because she has an unstable L2 fracture. Actually, it's an L1 fracture. And the physician who was treating her has seen the x-rays and the CT scan, stated we didn't need to put her on a board. Just keep her flat and you'll be fine. So a lot of hospitals, they have a flexible slider board that you can use to slide people across. So this nurse decided she had to be on this board to move her. So guess what happened? She immediately started having mass amounts of pain, and she was off that thing within about 2 minutes when the doctor walked in.
Perfect.
But
it's the best way to do that.
Yeah, it's just sometimes we run into that, and you do the best you can with it.
But that's okay. I mean, it's one of those things that I think that a certain level, as long as disagreements are handled professionally, that's what makes us grow.
Right.
The only time I have a problem with it is when they're kind of snotty remarks and when there's that level of disrespect. When it's one of those things where it's like they haven't even listened to my report yet, and they're going to go get another nebulizer,
right,
or a backboard, or something like that.
Even the question of, so why didn't you give her a nebulizer?
Just ask.
Yeah, just ask. I will explain all of my patient care.
Yeah, and that interface happens not just from transport paramedic to nurse, but also from fire paramedic to transport paramedic.
Right.
And I learned that when I started volunteering with one of the local fire agencies here. I was totally on the other side of the coin. And what I have found over time is that if I go in there, and sometimes you have a question, there's something you want to know about the patient that the fire paramedic has not told you yet. Here's a tip. Ask the fire paramedic.
Right.
It's kind of rude if you suddenly jump in and start asking the patient in front of them. It gives off the idea that you think the fire medic was incompetent and that they didn't ask that.
Well, and the thing is, it ends up ultimately making you look bad because you're re-asking questions that have already been asked.
Absolutely.
When I go on scene, I generally, if I'm going to talk to the patient, I will ask the person who's talking to the patient, you mind if I ask a few questions?
Yeah.
Or I will ask the questions directly. And if they have asked it, they'll give me the answer. And if they haven't, 9 times out of 10, they turn around and ask the question.
Right. Exactly.
And so, but it's best to have one person talking to the patient.
Absolutely. And also, you also got to weigh in when you are going to cause a ruckus, or if you are going to start redoing an exam, you got to make sure you only do that when it's necessary.
Right.
And by necessary, I mean it's going to affect the outcome of the patient.
Right.
A good story about when this was not done. I was working with a fairly new partner, and I was a supervisor at the time, but he was a fairly new paramedic, and we had got on scene to a patient who had injured her ankle. And she was sitting in a chair with her ankle actually just positioned in a position of comfort. And we're talking about moving her. And one of the things the fire department wanted to do was give some fentanyl before we move to help kind of kill the pain when we move her. It's a sound idea. But one of the things she had said is when we mentioned fentanyl, she says, I'm really sensitive to that medication. And I can only have it in like really low dosages because I've had it before. It's like, okay. So the fire department says, you know what, let's give her, the standard dose at that time was 50 micrograms. And we didn't have a protocol to drop it down to 25 micrograms at that time. But that was the fire department's idea was, well, let's give her a half dose. And my partner starts speaking up and he starts saying, well, we don't have a protocol for that. And the fire department snaps back erroneously. The fire department says, yes, we do. At that time, we did not. And they were wrong, technically. But here's my thing to the partner after that was done. I said, why did you make us think about that? He goes, we don't have a protocol for that. So they're going to give 25 micrograms. It's not going to hurt the patient.
No. If they want to double that
Yeah.
or triple it, then there's a problem. But
Yeah.
you're not going to do anything wrong, and you can justify that.
Absolutely. And it's one of those things where I'm sitting there and I'm like, and here's the problem. When you start calling out little things like that don't matter, the
Right.
fire department
Anybody.
or nurse, anyone, or your other partners for that matter, in your own agency, are going to see you someone who's always going to have a negative thing to say.
Mm-hmm.
So when you do come up with a legitimate point, they're going to have to they're going to have to filter that. Are you
Right.
just being negative like you always are, or
Right.
is this a legitimate problem I need to worry about?
Oh, yeah. Oh, no, it's legit.
Yeah.
You know, the thing is that I know our protocols and other places I've worked have something similar. They're written to the level of the prudent paramedic.
Yes.
So if, say, somebody pulled that chart and they came to me and said, well, protocol states 50 micrograms. Why did you only give 25? Oh, well, because the patient said she's hypersensitive to it and that she has to have a lower dose. Otherwise, it's just too much. Okay.
Yeah.
Nobody's going to call you out on that you did the right thing for the patient.
You know, and our physician advisors have said this before, and that is, as long as you are taking care of the patient, I'm not going to pull your license. Now, I might correct some things you're doing, and if you're not learning from your mistakes, different story. But I've
Right.
heard our physician advisors say, look, your primary goal is to take care of the patient. That's what you're doing. And if
Yeah.
you got to vary outside the protocol to do that sometimes, we understand. In fact, I would say that as a paramedic supervisor right now, I trust those that work at our company to know when to, the best ones are the ones who are effective rule breakers. In other words, they know exactly when to break a rule.
Me.
Because we can't well,
I'm joking.
but very literally you. I mean, you can effectively know when to break a rule because here's the truth about EMS is you cannot write a protocol for every situation.
As robust as people are in finding ways to hurt themselves, you could not make a rule for us to address every situation. And you know, like I was saying before, one of our first sentences on our protocol book is, these are written to the level of the prudent paramedic.
Well, and one of the things that you have said before, we've had, when you and I have worked together, we've had writers, and whenever a question comes up, so what can a paramedic...
Shut up, Chris, is usually what I say.
Well, right, but I mean, pertinent to what this is about. Whenever a writer asks, well, what can a paramedic do? Your response is usually, although you say it jovially, anything as long as we can justify it.
Right.
Because that's kind of true.
As long as you can... I had a partner when I first started who used to, whenever he was going to step outside the bounds, he used to run it through his head, like say it in his head, and end it with your honor or senator. And if he felt he could make it say, and I say, after the fact, could you sit in front of your medical director and make this sound legitimate? And not by lying or anything like that. That's not what I mean. But if you had to tell somebody after the fact who was not there and did not see it, could you say it to tell them your decision, make them go, okay, yeah, I saw what you did there.
Exactly.
Or will they be like, you're an idiot, which is usually what happens to me.
I'm going to go grab some water. Do you want some?
Yeah, please. Just stop this recording.
Yep.
Toast. Toast.
All right. So we're recording again.
So, other things people do. There's so many. I mean, really, it's kind of hard because a lot of these stories, to be a paramedic, you have to have a certain reflectiveness about what people do to themselves.
Mm-hmm.
And by this point, I mean that the things that medics a lot of times find humorous,
Come in just a little bit.
the things that medics find humorous,
Yeah.
if you step back and take a look at them, they're actually fairly sad that this has happened to people. The fact that that gentleman was at a point in his life where the best option was to place his junk inside a ring, you know. If you think about that, that's not, we find that funny, but I mean, the guy was in a lot of pain and he lost part of his junk.
Super embarrassed too, and he told his buddy, and now all his friends know.
He called on his buddy for help, who
that was a
then
terrible
called
friend.
all of his other buddies just to brag about how bad this guy messed up.
Oh yeah.
So this guy will never live this down.
Nope.
He will
Everyone knows
probably
he's a
never
eunuch.
get it up. Seriously. I mean, he's probably lost his sex life,
Yep.
you know. So a lot of stuff that we see can also went to a call for a guy who had been beat up.
Mm-hmm.
Sounds sad.
Yeah.
He got beat up because he was trying to climb. He was 42 years old and he was trying to climb into a 12-year-old's window. And the dad heard this and came in and beat the tar out of him.
Yeah, I can see that.
Yeah, you know. So we get there and they're like, "Oh yeah, this is the guy that was beat up." I'm like, well, "Where's the other guy?" "Well, he's inside. He's the dad." And they tell us what's going on. I went and checked on the dad.
Yeah.
Because, hey, are you okay? And he's in there and he's still angry.
Yeah.
Rightly so. And he's venting and he starts to say, "I see him again. I'm going to kill." Whoa, whoa, whoa. You need to stop talking. Because although I agree with his sentiment, I don't want to have to testify against you.
Right.
You know, because if you say that,
Yeah.
and then something happens to him, they're going to have to come back to us and say, yes, we heard him say that. So I don't want to testify against you, but
Yeah.
yeah.
Can you just do me a little bit of a favor? Sorry, man. If you can scoot in more in general.
Oh, good God.
Well, I know. Just you're hitting green on my mic when you talk, which means we're going to hear two voices.
Toast.
There you go. That's a little sexier.
Hi, Chris.
Hi, Mark.
So,
Yeah.
you know, so, I mean, when we talk about these sort of things, it's part of, I guess, a defense mechanism is seeing it as humorous.
Mm-hmm.
Part of it is you see this stuff enough, and it's amazing how ununique, although these situations are unique to this person, how ununique they are in general.
Well, it's probably unique to most of the listeners, too.
Right.
I think most people listening right now would be like, oh, this is a 1 in a million. It's not.
No.
Mark and I both have penis stuck in object stories.
Right.
You know what?
And rectum stuck stories.
Almost every paramedic does.
Right.
You know, that's done it for any, you know, noteworthy amount of time.
Right.
Here's a question for you, Mark. How do you feel about when non-EMS people ask you about your craziest call or your worst call, or what's the craziest thing you've ever seen?
So it depends on how they ask it. If they ask me what's the worst thing I ever see, my statement of that is I don't talk about that in public.
Yeah, that's true.
Because we see some wildly horrific things.
Messed up
Plus,
stuff.
what I consider the worst thing, I mean, because that is, to say the worst thing I've ever seen, we have to define that.
Yeah. From
Is
what
it
angle?
the goriest?
Is it the saddest?
Is it the saddest? Is it a mixture of the two?
Mm-hmm.
You know,
Was it
because
the hardest call?
right?
Because honestly, a really gory call can be medically an easy call.
Oh yeah,
You know,
absolutely.
Shotgun to the face, as gory as that can be, medically fairly simplistic.
As long as you can get the tube, you're good.
Yeah. Or if they're dead, even easier because
Right.
call it and walk away.
You know,
It's-
but so yeah, I mean that's the problem with that question. The last time I was asked that question was I was lecturing in front of a class of high schoolers, and I remember I saw the teacher tense up immediately as soon as a kid asked it, and I said, I don't talk about that in a public forum.
Yeah.
Because, A, what I think is gory or bad or whatever may not be to you. And B, although you may be interested in hearing that, not everybody in the room is interested in hearing that. And a lot of people don't want to know.
I'm just not interested in telling it sometimes, too.
Yeah.
You know, because some of these things, like, I mean, I've got 1 or 2 calls in there that I just don't want to, I don't want to talk about. I don't even want to really think about them. And, but I have thought about it, have dealt with them. And it's just one of those things where it's like, it's not a good memory for me.
No.
It's something I want to bring
Not
up.
at all.
That being said, you know, on social media, amongst other paramedics, every now and then a meme will get passed around that has a very, I would almost say, negative outlook on the person who asks. I don't fault necessarily the person who asks for asking the question, to tell you the honest truth. It doesn't bother me when people ask because I don't think, because to me it's all about intent. You just
Right.
want to talk to a paramedic, and that's the only thing you can think to say.
Yeah, exactly.
The last time I heard is I walked into a gas station, and the guy behind the gas station, which is, you know, it's night shift, and I think there's a certain camaraderie about everyone who works night shift, whether you're a cop, the gas station attendant,
Right.
or a paramedic. And you kind of walk in there and just kind of BSing with this guy while I buy jerky or Lord knows what it is I'm buying. And he asked me that question. And so I ended up telling him the ring story that I told earlier with that instead. So, and he asked me, I'm like, well, I'll tell you the funniest one. And I tell him
Right.
that. You know, and it's kind of one of those things where, you know, he's not, he doesn't want to, you know, have me drudge up stuff. It just doesn't occur to him
Right.
that much. And it doesn't bother me.
And legitimately, some of the stuff we see probably should be nightmare inducing.
Yeah.
You know, I
But
mean,
we're a little weird, so.
yeah, we are a little weird. You know, I remember early on in my career. Excuse me. So anyway, one of the calls we go on a lot is it's called a DOS or a DOA.
Yep.
Death on arrival or death on scene.
Mm-hmm.
And these are not uncommon, especially in the middle of the night. Somebody rolls over and their loved one is dead, and they've been dead for a while.
Mm-hmm.
You know, so you show up, you verify that they are dead, and so we had our monitor out and everything like that. My partner is out talking to the family, consoling them, helping them start through the process of not just grieving, but what's going to happen. The police are going to show up. They're going to talk to you about things. This is standard operating procedure. Don't be freaked out, you know. Do we need to call family members?
Right.
Which, on a side note, the most common response I've gotten when I've called family members to tell them what their father or mother or somebody in there that's close to them has died, the most common response I've always gotten is, "Are you kidding?"
No.
Yeah, because that's how I get my kicks, is calling up random strangers and telling them horrific news. You
Yeah,
know?
that's...
But I'm standing there and I'm putting away our kits and everything like that. He's busy. And I walk in, or he walks in, and he starts laughing at me because he'd been standing at the door watching me. And like every 20 seconds, I'm putting away my monitor, I'd stop, put my shoulder at the body. Yeah, just make sure it wasn't standing up on the bed getting ready to attack me from behind.
Well, it could... Hey, I've seen enough zombie movies to be legitimately
Exactly,
afraid of that.
you know.
Yeah, and that's actually kind of brings up a good point. I did have one person ask me once, and this was a long time ago. It was actually a transfer patient. And he did ask us, so how do you deal with... And he was much older than me, and so I remember thinking this was a weird question coming from someone so much older than me. But I also realized that when you're in EMS, especially when you start young, you age a little faster than the rest of the planet. But I feel that way anyway. Emotionally, I think you do.
You regressed.
Well, no. Mentally, I regressed, but emotionally. And he had asked, he goes, well, how do you deal with all the dead bodies and all that, all the dead people and all that stuff? And I kind of thought about it. And here's the thing. Dead people don't bother me at all. Because here's the truth, Mark. I've never been dead.
What?
Not once.
Oh, come on.
But I have lost some
Not
money.
even le petit mort?
No, not even... What? A little dead?
The little French? Death. Well, yes, that's the French term for orgasm. Le petit mort. The little death. You don't believe me, do you?
Not at all.
That is what the French call an orgasm, is the little death.
Okay.
So you've never had a le petit mort?
Okay, is this on Facebook or is this real?
No, this is legit. Okay, that's it. Google, here we go.
Here we go. While he's Googling that, so kind of where this boils down to is I've never been dead before, or even a little dead, Mark.
I'm sorry for Jessie.
Don't be sorry for her. Be sorry for me. It's actually kind of a great deal for her.
Yeah, she has to deal with you.
Yeah. Oh, there's that. But I've never been dead before, but I have lost somebody. And so for me, the hardest calls are the ones with family members that are very involved in watching their loved one die. And that is something that's so relatable and can be so crushing when you see it, that it can stick with you. And so you go in those scenes, they talk about hearing screams and that kind of stuff. I can't think of a single time where I really remember the screams of a patient. I've remembered the pleading of a patient and that kind of stuff. But the things that stuck with me the most are the screams of parents and those kind of things.
Right.
Anyway, back to French orgasms. Let's just make that segue.
Merci. La Petite Mort. This is Wikipedia. La Petite Mort, French pronunciation, La Petite Mort, the little death, is an expression of which means the brief loss or weakening of consciousness, and in modern usage refers specifically to the sensation of orgasm as likened to death.
Okay, Google.
The first attested use of the
How do
expression...
the French say orgasm?
Oh, good Lord.
I can do a search for that.
Please do.
You want Urban Dictionary?
I just came up with the exact same Wikipedia article you
The little death is a translation from the French Le Petit Mort, a popular reference to a sexual orgasm, as opposed to other kind of orgasm.
The French do everything so smooth. I mean, that even sounds romantic.
Oh, mademoiselle, you like the Petit Mort? Yes? Oh. So, anyway, back to what Chris was talking about.
No, I finished.
You finished? So, yeah, okay. So we see a lot of things. So, oh, I'm glad we don't videotape this. So, yeah, there's a lot of things we don't want to talk about. There's a lot of things that we probably, don't need to relate.
Yeah.
We keep it amongst ourselves. We talk about it in the front of the ambulance. We talk it about back at station or with other medics. I was talking to, Spencer from our last episode.
Yeah.
He and I were having a conversation one time about a paramedic who EMS broke this guy.
Spencer?
No, it didn't break Spencer. He and I were talking about this other gentleman.
Oh, gotcha.
And, I mean, he went from being a paramedic to a boogie boarder.
Oh, wow.
In Hawaii, is what I heard. But my question to Spencer was not about this guy. It was about us. How come he's the broken one?
Right.
Why aren't we the broken ones? I've been doing this 25 years this year.
Yeah.
And I still love my job.
Right.
Most of the time. Except when Chris is supervising. Then it's just painful.
Yeah, it's hard.
But,
it's for everyone involved,
I still enjoy being a paramedic. I still get... when you have what we call, again, this is the gallows humor, the good calls.
Yeah.
And for me, a good call, some people really like trauma.
Right.
Trauma to me is easy. You load them up, you go fast, you start IVs.
Yeah.
I mean,
Occasionally go for an
you
airway.
get a good medical call that either makes you think. I had one the other day. We went to a Kaiser clinic, right, for chest pain. Came as a 911 call. We get there, they hand me the 12 lead. That's an MI. That's a STEMI. We have ST elevation in V2, V3, V4. We have reciprocal changes in 1 and 2.
Major heart attack.
Right? So, fire department's now running one of their 12 leads and one of the main reasons is because we can transmit from our monitors straight to the hospital so they can see them.
Yeah.
And I asked them, hey, great, can you transmit that when you're done? Absolutely. I call the hospital, I give them a heads up. We're about 7 minutes out. We're getting the patient loaded up, So, we did a third 12 lead on the way to the hospital because fire's 12 lead wasn't definitive, but there was a lot of artifact.
Right.
Right. So we get to the hospital and we roll in and I show them the clinic's 12 lead and my 12 lead. And now they're scrambling because they didn't call it a STEMI. They didn't do an activation based on the 12 lead they received.
Okay.
And they're like, and the doctor was like, man, I'm sorry. He apologized to me for not, he goes, you called it in. I said, well, yeah, but the 12 you're looking at is pretty non-definitive just because of the artifact. He goes, well, yeah, but still, I should have put some credence in the fact that you did it. You pulled that trigger and you called it. But those calls to me, or we had a gentleman a while back, we get there, and what the fire department had been told, right, I'm not putting this on the fire department, was he has a clot in his brain. Clot or a tumor? Because Generally, they don't just leave clots. They do so. They can do stuff about that now.
Just put that there.
Should be fine.
Yeah, it's a dangerous roadway anyway.
And they're like, we don't know. They hadn't been there very long, everything like that. So we get them on the gurney. We take them out to the truck. There were some other things going on. I go, so do you have a clot in your brain? He goes, no, I have a malformation. Okay, that's different. We're now at the back of the ambulance as he's telling me this. We load him in, everything like that. We do a quick 12 lead because he was bradycardic and a little hypertensive. So he has a cavernous. I said, what kind of malformation do you have? He goes, it's a cavernous malformation.
Okay, so a hole.
Well, and I actually said that to him. I go, so when people say you got a hole in your head, they're actually more right than what they know. And he laughed. He goes, exactly. So what this is a thinning of the vasculature anywhere in the body, but generally in the head and the spinal cord, where the vasculature actually becomes permeable and blood leaks out into the surrounding brain tissue.
Wow.
And can cause a minor form of Cushing's triad. Heart rate was low, blood pressure was up.
That makes sense.
You know.
Cushing's triad is a series of signs that you can observe as a paramedic. 3 signs, go figure, that indicate an increase in intracranial pressure, pressure inside your skull.
Yeah, and so that's what he was doing, and they ended up taking him to CT, but you know, it's those calls I find the most interesting.
Yeah, where you really got to
because I told him straight up, okay, I'm not exactly sure what that means, but you can bet your sweetheart I'm going to be Googling it when we get done with this call. And we did. We Googled it and learned a lot about it. So
I think the people that
not as much as Chris has learned about Le Petit Mort tonight. But
right, exactly. I think the people that I see burn out are the people that I think maybe weren't adequately prepared for the amount of, put it bluntly, bad shit that actually happens out there.
Right.
I think a lot of people kind of get this perception that, you know, 911 isn't used 8-10 times a day in just on your truck.
Right.
We're running hundreds of calls a day.
Mm-hmm.
You know, and then they see it time and time again. They weren't prepared for that.
On average, our crews are running about 100 transports a month.
Yeah. That's one crew.
Right.
That's not 100 transports a month for the area. That's one crew in that month for an agency that's running 24 crews a day. Mm-hmm. So that's a lot of 44 shifts a month. Right. You know, that's a lot of calls when you start thinking about it. And that's what I think can get overwhelming for people.
Yeah, I think part of it is that. Mm-hmm. I think part of it is, unfortunately, the repetition of some of the calls that you have.
That is true. There's also the flip side of that is that
we run a lot of
boring BS calls.
Yeah, BS calls, but just calls that maybe there could be another outcome that would be highly acceptable, but nobody wants to put the effort into it.
Right.
You know, we get the calls a lot at nursing homes where, well, we called the doctor said send him to the ER.
Right. But really all they need is like a wound dressing change.
Right.
Or reinsert their catheter.
Right.
You know, we're sending people to the emergency room for this.
So I think that's what burns out a lot of people. I also think the people that get truly burned out, to a certain extent, lose that curiosity.
That's true.
And for many reasons, it's not anything that necessarily they're doing, but, you know, the job wears you down physically, emotionally, mentally. I mean, you walk away from work after a busy day with critical patients and you're worn out.
Yeah. EMS is a changing landscape right now, too. We're starting to see less acute patients more and more and more as time goes on. And I think that's also where the education part of paramedic training and EMT training needs to catch up, is because we're teaching everyone that, oh yeah, people only call you for strokes and heart attacks and gunshot wounds.
Oh yeah, in paramedic school or in EMT basic school, yeah, it's going to be death and mayhem every day.
Oh, absolutely. And then you get out into the real world, it's like, okay, you've had flu-like symptoms for a week and you haven't done anything about it.
And now at 5 o'clock on Friday night, you want to go to the emergency room.
Right, exactly.
You know,
so
I had this call just yesterday.
Yeah, right. Well, and the reason that I could make up that call, you know, off the top of my head, and you can be like, yeah, I did that yesterday.
Because you're not making it up.
Yeah, is a testament. Well, and in that case, I didn't think of a particular call. That scenario just popped out because it's so common. I
have picked up a person, diarrhea for 3 weeks. It's done nothing to address it.
Right.
Now they want to go to the emergency room by ambulance.
Yeah.
They walk out of their house,
Well, I can't get a ride, man.
arm in arm. Oh, no, this gets better. This is a
good.
specific call. Comes walking out of the house, arm in arm with a firefighter, chatting away. Comes out, climbs on the gurney.
Adorable.
We take him to the hospital. They're telling me what's going on. We draw labs for a local hospital. I start a line. I draw some labs. We go to the hospital. We get there. They're busy. They're very busy. She's got to go to triage, which is in this particular hospital, a lot of hospitals, is out in the waiting room. Mm-hmm. You'll be evaluated by a nurse, and when they get a free room, you'll be brought back. On some aspects, going to triage is good because it means you're not critical.
Yeah.
You know, this lady gets upset that we went to triage.
We have to wait.
Why did she get upset? Because she wanted to jump the line. The only reason she called was she wanted to not sit in the waiting room.
It's not how it works.
And so we're lowering her down to put her in a wheelchair in the waiting room. Her two friends who were on scene are standing there. And she says, well, if I'd known this was going to happen, I would just ridden up with you two.
Probably should have.
That's the kind of stuff that burns people out.
Yeah.
Is
It's frustrating.
It
and
is.
that kind of goes back to what I was talking about is in the intent of people bother me. If someone just doesn't know any better and they call 911, doesn't bother me. It does not bother me. Like Harlan Brock was actually my partner on this, but we'll cut this out. The other day I was
you can
working.
say his name.
Yeah. The other day I was working with a fairly senior paramedic, and we went on a call where we had heard the readback came over that a child was playing with a razor blade and had cut their tongue. This is I want to say like a 1-year-old. That could actually be bad.
Right.
What we actually get there is that the child had cut their thumb. And we get up there
Subtle difference.
and they're panicking, and we start washing the kid's hands with saline because the blood's dried, it's not bleeding anymore. The kid's chill.
Right.
When your 1-year-old is chill and you're not, clue in. But anyway, we wipe the hand, we see, okay, yeah, there's a little cut right there. Do you guys have any Band-Aids? Like, well, do you think it needs stitches? No.
No.
Absolutely does not need stitches.
I have picked up an 8-month-old who was teething and taken him to the hospital
Right.
with the father following us in their car.
Yeah, and it's just like, look, we're not going to do anything. And so we didn't end up transporting this child, but those people didn't bother me because they were freaked out, and it bothers me a little bit that they couldn't handle this, you know? But they were freaked out. They weren't trying to abuse anything.
No.
They just didn't know any better. And so you explained to them, it's like, look, it's a little cut, and you get a Band-Aid, they'll be fine. You know.
I haven't really heard it used up here in Oklahoma. We had a term for this.
Okay.
Panicking parent syndrome.
Oh, yeah, sure.
This was the brand new mom who called us because the baby spit up.
Right. Yeah, these kind of things. That doesn't bother me so much. What does bother me, though, is the people like your patient who do know better. They know exactly what they're doing. They're aware that they're abusing the system. And what bothers me the most is that they don't care.
No.
What they don't seem to understand is that, look, this is an ambulance that you're taking away from someone else. There's a fire crew that's here. So, and the worst part is the effect on because the fire department has to come from a station.
Right.
Okay, there's not like another station's not going to move over closer. At least with the ambulances, we move the ambulances around to try and get better coverage.
But still,
Still, though,
we don't cover as effectively with less ambulances available.
absolutely. And you're taking these resources away from someone who doesn't want to just skip the line, from someone who
Right.
could be having a heart attack.
Or worse.
Yeah, and I don't know if that doesn't occur to some people, or if it
I
does.
don't think it occurs to them. I want to believe it doesn't occur to them because the other option is they just care so little for fellow human beings that they do it anyway.
We have this is a term that is used in EMS quite frequently, a frequent flyer in our area who has been told what he's doing, and he still does not care. And that's kind of one of the armbands, or the, I guess, arm bars that EMS is in, is we're in this arm bar of liability. In the sense
Way
that...
to enunciate armbar to cover up the armband comment.
Whatevs. This is kind of where we're stuck a little bit, is we're in this this liability problem, and that is
We
that-
can't refuse transport to somebody.
absolutely the only time we can tell someone no is if it's a safety problem.
Right.
And even still, we get someone else to come in and make it safe and still end up transporting.
Right.
So it's one of those things that we know they're not sick, but we're not able to just say no.
Right.
And they know that. And we tell them what they're doing, and they just don't care. And that that is so deeply disturbing to me. Anyway, well, I think we're going to try and talk about training, but we're at an hour. We should save that for a different...
I think we should.
Yeah, we're going to save that for a different...
we should.
I thought about this show like before we did it, and I'm like, it's either going to go really quick, or I'm going to have to be like, all right, put the brakes on.
Right.
And I should have known,
yeah.
put the brakes.
Yeah.
So anyway, well, Mark,
well, have a good evening.
You too.
Thank you, everybody, for listening.
Yeah.
And remember, don't do anything that's going to make us come make you naked.
Yeah, absolutely. Bye.
Toast.
Toast.